Hello, everybody. All right, so you are on a Dr. Y channel, and I am Dr. Armen, Professor Armen Astvatsatryan from Europe and Armenia, and we continue to talk about your big exams. So, questions of your exams, questions, last exams, so last state exams. So today's question, please open the questions, are all about chronic bronchitis. So sometimes you pronounce bronchitis, bronchitis, but bronchitis is more correct form, of course. But if you said bronchitis, I will understand. So chronic bronchitis. So what is chronic bronchitis? So you have to answer, if you find this question on your exams, in this manner. So what is chronic bronchitis? Chronic bronchitis is a type of chronic obstructive pulmonary disease that involves inflammation and narrowing of the airways in the lungs. It's characterized by a present cough that produced mucus, sputum, and occurs most days of the month for at least 3 months in a year for 2 consecutive years. Chronic bronchitis is typically caused by exposure to irritants such as cigarette smoke, air pollution, and occupational dust and chemicals. The symptoms of chronic bronchitis include shortness of breath, wheezing, chest tightness, and coughing up phlegm. The condition is diagnosed based on the symptoms, medical history, physical examination, pulmonary function test, and treatment involves quit smoking if the person is a smoker, managing symptoms with bronchodilators and other medications, and avoiding exposure to irritants. In severe cases, oxygen therapy and pulmonary rehabilitation may also be necessary. So if it's me on the exams, it's largely sufficient for me on the question of chronic bronchitis. Largely sufficient. But if they be another guys, another professors, so I find questions like this, for example, etiology, pathology, pathogenesis, pathophysiology means classification, laboratory functional radiological diagnosis means data of chronic bronchitis. Oh, so you have to answer. So etiology, the primary cause, So etiology, the primary cause of chronic bronchitis is a long-term exposure to irritants that damage the lining of the bronchial tubes and cause inflammation. Actually, between us, all problems in our body is inflammation, but beside that. So irritants that damage the lining of the bronchial tubes and caused by that inflammation. The most common irritant, of course, is the cigarette smoke. So all problems from bronchitis, chronic, non-chronic, this is a problem. Chronic obstructive pulmonary disease is a problem of smokers. But anyway, other irritants such as air pollution, occupation dust, not occupational, of course, dust, professional problem, professional disease, chemicals, and indoor air pollution from wood burning stoves, for example, or fireplaces, can also contribute to the development of chronic bronchitis. Long term, of course, acting, long term impact. In rare cases, chronic bronchitis may be caused by some genetic factors or repeated respiratory infections. It happened. So, about pathogenesis. No, pathophysiology. Pathogenesis, repeated exposure to irritants. I understand it's the same answer, but anyway, the question is like this. So, repeated exposure to irritants causes the bronchial tubes to become inflamed and produce lot of mucus. The excess mucus narrows the airways, making it difficult for air to move in and out of the lungs. Over time, the walls of the bronchial tubes thicken, and become so connective tissue, further narrowing the airways and making breathing even more difficult. So actually, it's a chronic obstructive pulmonary disease. So actually, chronic bronchitis is a part of, with emphysema, is a part of chronic obstructive pulmonary disease. So classification, yeah. Chronic bronchitis is classified as a type of chronic obstructive pulmonary disease. So COPD is typically classified based on the severity of airflow limitation as measured by pulmonary function test. Pulmonary function test. The Global Initiative for Chronic Obstructive Lung Disease, GOLD. We talked about that in previous lectures. Especially when we talked about chronic obstructive pulmonary disease. So, global initiative for the chronic obstructive lung disease, GOLD. Classification system is commonly used, the categorized problem, into 4 stages, from light to severe, based on the patient's symptoms, lungs function, and risk of exacerbations. I will not repeat, you can find it in a chronic obstructive pulmonary disease. Concerning laboratory diagnosis. Laboratory means pulmonary function test, PFT, are used to diagnose and monitor chronic bronchitis. A PFT measure how much air a person can breathe in and out, how quickly they can exhale, and how efficiently their lungs exchange oxygen and carbon dioxide. The most common PFT, pulmonary function test, used to diagnose COPD is spirometry, which measures the amount of air a person can exhale forcefully in 1 second, forced expiratory volume in 1 second, or FEV1, and total amount of air they can exhale, force vital capacity, FEVC. Radiological diagnosis, chest X-ray and computer tomography scans may be used to assess the severity of chronic bronchitis and rule out the lung conditions, other lung conditions, such as, for example, lung cancer. Chest X-ray may show signs of lung hyperinflation and flattened diaphragms pattern, while computer tomography scans can provide more detailed images of the lungs and bronchial tubes. So another question, I see clinic. When you find a question like this, it means science, science and symptoms. So clinic of non-obstructive chronic bronchitis means signs of symptoms of. Clinic is the signs and symptoms of non-obstructive bronchitis. We'll talk about non-obstructive bronchitis. Okay, so non-obstructive chronic bronchitis is a type of chronic bronchitis, of course, where there is inflammation and excessive mucus production in the bronchial tubes, but, no, the name, non-obstructive, but the airway obstruction is not significant. Hemodynamically. No, then it's not significant. The signs and symptoms of non-obstructive chronic bronchitis may include chronic cough, persistent cough that lasts for several months in a common symptom of non-obstructive chronic bronchitis. The cough may produce clear or white mucus, sputum. Dyspnea, shortness of breath. The inflammation in the bronchial tubes can make it difficult to breathe, resulting in shortness of breath. Chest tightness. Some people with non-obstructive chronic bronchitis may experience chest tightness or discomfort. Fatigue, the effort required to breathe can lead to fatigue and reduced ability to perform physical activities. Recurrent respiratory infections. People with non-obstructive chronic bronchitis may be more susceptible to respiratory infections such as colds and flu. Let's remember that, huh? They are more susceptible to these problems. That's why they are always with problems with colds and flu. Wheezing. Wheezing may occur in some cases, although it is not as common as is classic obstructive chronic bronchitis. It's important to know that the symptoms of non-obstructive chronic bronchitis may overlap with those for other respiratory conditions such as asthma, so classic chronic obstructive pulmonary disease, or allergic rhinitis, sinusitis. A medical evaluation and pulmonary function tests can help to distinguish between these conditions and provide an accurate diagnosis and that, in this way, accurate treatment. Chronic bronchitis can affect people of all ages. So why I ask him, telling you? Because I see the question, features of the course, no? Features of the chronic bronchitis in all ages. Means in children, adolescents, and old age, and aged persons. So features in young and old ages. So once again, chronic bronchitis can affect people of all ages, but the course of the disease may slightly differ in adolescents and old age. Adolescents, chronic bronchitis in adolescents is often associated with smoking or exposure to second-hand smoke. Second-hand smoke. The disease can have a significant impact on the quality of life, may interfere with normal activities such as sports and physical education. In adolescents, chronic bronchitis may be complicated by asthma or allergies, which can exacerbate symptoms and make it difficult to manage the disease. Treatment typically involve a combination of medications such as bronchodilators, or inhaled steroids, and lifestyle modifications such as smoking cessation and avoidance of environmental irritants. So actually, we have to talk to parents and explain them to kids smoking. It's a wildness to smoke at home. Anyway, old age, it's aged persons. Chronic bronchitis in aged persons is often associated with long-term smoking or exposure to environmental pollutions over many years. As people's age, their lung function naturally declines, which can exacerbate the symptoms of chronic bronchitis. Older adults with chronic bronchitis may experience more severe symptoms such as shortness of breath, wheezing, and coughing up mucus, sputum. They may also be susceptible to respiratory infections, which can lead to exacerbations of the disease. Treatment for chronic bronchitis in old age typically involves the same medication used in younger adults. Okay, as well as oxygen therapy in cases of severe respiratory impairment. Pulmonary rehabilitation, which involves exercise training, breathing techniques, and education on disease management, can also be beneficial in improving symptoms and quality of life. So finally, long question like this, I adore questions in this manner. So differential diagnosis, treatment, rehabilitation, prevention, etc., of chronic bronchitis. Okay, let's go. So differential diagnosis. The symptoms of chronic bronchitis can be similar to other respiratory conditions, and therefore a differential diagnosis should be made. The differential diagnosis for chronic bronchitis includes asthma, chronic obstructive pulmonary disease, pneumonia, bronchiectasis, lung cancer, and tuberculosis. The treatment of chronic bronchitis depends on the severity of the disease, the frequency and severity of the exacerbations, and the underlying cause. The primary goal of treatment to alleviate symptoms, improve lung function, and prevent exacerbations, complications. Medication, bronchodilators, corticosteroids, and antibiotics may be prescribed depending on the severity and cause of the disease. Oxygen therapy. Supplement oxygen may be prescribed for severe chronic bronchitis, especially in cases where blood oxygen levels are low. Depends on saturation. Pulmonary rehabilitation, a structured exercise program that includes breathing exercises that works perfectly. Education and support can improve lung function, reduce symptoms, and improve quality of life. Now, pulmonary rehabilitation is a crucial component of the management of chronic bronchitis. Pulmonary rehabilitation involves a structured good exercise program, breathing techniques, and education of disease management. It can improve lung function, reduce symptoms, and improve quality of life significantly. Pulmonary rehabilitation programs are typically conducted in supervised setting, but home-based programs are also available. Prevention. Preventing chronic bronchitis involves reducing exposure risk factors as, of course, first of all, smoking, air pollution, and occupational irritants. Other preventive measures include, of course, quitting smoking. That's the most and the principal effective way to prevent chronic bronchitis. First hand, second hand, third hand, doesn't matter. Any types of smoking. Avoiding second-hand smoke. Exposure to second-hand smoke can also increase the risk of chronic bronchitis. So you have to explain to parents to quit smoking if they've got children at home or adults, aged persons, of course. Reducing exposure, maximum reducing exposure to air pollution, avoiding outdoor air pollution, or wearing a mask if you're working. Can reduce the risk of chronic bronchitis. Using protective equipment. Using protective equipment such as masks or respirators can help to reduce exposure to occupational irritants. Minors, for example. Of course, getting vaccination against influenza and pneumonia can help prevent respiratory infection. That can lead to exacerbations of chronic bronchitis. Says it's okay, So you remark that this is a 17 minutes to answer only one question. Now, of course, it's impossible during big exams. So beginning is the most important of this lecture. So once again, my dear friends, you have to, my good advice, re-listening these videos with your pens and papers to make the notes, and maybe with earrings, with listening the earphones, the gadgets, to re-listening, to remember this by heart. Not only actually for the exams, but for your future medical life. Okay, thanks for your attention, my dear friends. Don't forget to subscribe and not just subscribe and follow the channel. Don't just put the ring on and do nothing, So, okay, God bless you. See you in another lectures. Bye-bye.